what it means? So you're
What about our kids, Brian? What about our kids?
What about your kids?
Explain why they've all got bowel disorders.
No, I can't. They haven't all got bowel disorders. All what kids?
70%.
70% of what?
70% of our autistic kids.
Hang on. You're saying that 70% of autistic children have bowel disease?
Oh, yes.
70% of our children.
Who's our?
With autism.
Parents.
Your parents here.
No, but so 70% of parents here today, their children have bowel disease. Well, why couldn't Wakefield find any children with
They
bowel
also
disease?
have seizures.
They didn't have bowel disease.
They also have
They didn't have bowel
behavioural
disease.
problems.
They didn't have bowel disease. Have you been in the hearing? I've sat through 12 weeks, right? Those children didn't have bowel disease.
Brian,
Well, I don't know if you want to talk to me about your case.
this is bowel disease, Brian. This is what it looks like.
No, that's an X-ray.
That's an impacted bowel. That is
An impacted bowel is not bowel disease, that's constipation.
Oh,
That's what the doctor
the diagnosis is bowel disease.
Whose diagnosis?
The gastroenterologist diagnosis. Gastroenterologist.
That is not bowel disease. I mean,
I've got a diagnosis of
from
bowel
whom?
disease.
From whom?
Gastroenterologist. I'm not telling you what
What are the viral three?
Brian.
Look at that picture, Brian. Look at that boy's bowel, Brian.
That is not bowel disease.
Listen, dear, look at that.
That's not bowel disease.
That's bowel disease.
That's diarrhea.
That's bowel disease.
That's diarrhea.
That boy has inflammation.
Diarrhea
These
is
children
caused by
have
enormous numbers of
inflammation.
things. You should have come to the hearing and you would have heard the medical
We
evidence.
don't have to come to the hearing.
Look, you already
our
know.
children are sick every day.
These children,
Where are your children, Brian?
They sit on the toilet for an hour every day.
you should look at
Trying
what
to
the
have a
government has
bowel
said.
movement.
See, what you do is you spread around these stories
Now what you do is
Which
big
aren't
spin it round.
and you mislead other parents
We've actually got
and
test results
actually
to prove it.
victimise them.
We've got test results to prove
You're
it.
actually victimising the parents of children
making a fool of
who
yourself,
don't
mate.
need to be victimised. You should try and get the actual American government statement on this and not spread these untruths.
No, it's true. We've got test results.
The tide's turning, Brian.
What you're involved in here
Yeah.
is just a festival of fabrication.
A bit like that is in there, you mean?
Well, no, perhaps if you come and listen to the hearing
Well, yeah.
and heard the evidence, you
Yeah, we know the evidence.
But you see your ears are closed, aren't they?
Brian, do you realise you've staked your professional reputation on what the GMC decides? Isn't
No, I
that a bit of a risk?
No.
But if they decide that
Let me ask you this question. If the General Medical Council approaches a journalist and says, you've published this material, would you supply us with any evidence you've got, any documents you have, any material? Does that journalist have let me ask you the question, does that journalist have a responsibility, a public duty, to give them that material or not? Of course. And I did. So have I done something wrong? No, not at all. So I haven't done something wrong.
I'm not.
So what's all this abuse of me? What's all this abuse? Posters being held up abusing me? Threats to me?
No, I haven't organised any of that. I'm just
So where's my duty? If the General Medical Council of the United Kingdom comes to a journalist and says, you have supplied
the truth, whatever that truth
well,
is.
so you're saying that it was my public duty to supply my findings on request from the GMC to them. So why are these groups then publishing these outrageous lies about me, saying that I'm working for the drug industry? Who's paying you? There was some placard out here today saying something about who's pulling your strings or something, and all this kind of stuff. There's some dribbling idiot you've got with you, a guy called Walker, an absolute dribbling idiot, publishing material suggesting that I'm in a conspiracy.
With inflammation of the bowel.
I'm in a conspiracy with the government and the drug industry.
Children aren't going to disappear, Brian.
Inflicting injuries on children.
That's no problems, Brian.
Look at that.
Against me. That's the allegation against me.
I don't think there is a conspiracy. I don't think
That's
there is a cover-up.
well, why are you
What's that-
involved
what's
with this
it-
cry shame organisation that is publishing these outrageous lies that there's a conspiracy and I'm being paid by drug companies to fabricate evidence with the government and God knows what else? Well, then you should get onto these people and say, why are you publishing this
I'm
stuff?
more concerned to get to the truth as to what's happened to the children like
Then you
myself.
should come to the hearings and hear.
What about the children,
What
Brian?
about the children? 12 weeks of evidence. showing that these children, well, I don't know which children are which, but the children that
1 in 100, Brian.
did not
Do you
have
care about
an
our
inflammatory
children?
bowel disease.
The 12 children.
They did not have an
Do you care
inflammatory
about
bowel
the
disease.
1 in 100 children, Brian?
It's 2000.
Ask Isabella Thomas, is she here? Is Isabella here? Ask Mrs. Thomas whether her 2 children have got regressive autism. Ask her whether they've got inflammatory bowel
What about the
disease.
research that happened between
Ask her.
1998
My children.
No, well, let's just deal with that. That's what they're dealing with.
I'm
not going to get involved in 10 years of.
I think you focused on the wrong issue. You focused on the 1998 paper. We focused.
I gave the GMC the findings that I had at the time.
Well, that's right to do that. But we're focused on the kids, and it's 2008 now. What about the evidence that's emerged since?
Well, that's a different issue. I'm not here to debate. I'm not here to find something that I've published saying that MMR does or doesn't cause autism. Have you found anything that I've published saying whether or not MMR does or doesn't cause autism?
I'm interested in people who find
Have I? Well, I'm not
evidence.
responsible for that.
No, I understand. You're a journalist.
I do my job on that particular subject, and I did
You,
it.
as a good journalist, you presumably want to report the Hannah Poling case.
What about the Hannah Poling case?
Have you read it?
Mitochondrial injury.
Have you read the journal?
Mitochondrial inherited disease.
Leading to autistic-like symptoms?
Autistic-like symptoms
Following
followed
aggravated by vaccination?
with 9 vaccines leading to fever.
How do you know that
That's not an
children
admission.
like-
The American government has stated absolutely explicitly. I'm not arguing for the American government. They have stated absolutely
But
explicitly.
how do you know my
many
son isn't
agencies?
like Hannah Poling?
Well, I don't.
Well, that's right. That's why I'm here.
So,
to try and draw
are
attention
you
to
one of
it.
those people who thinks that the American Centers for Disease Control, the National Institutes of Health, the Institute of Medicine, and all the paediatricians in the world are all involved in a conspiracy
No, I don't
to
think-
cover up
No, I don't think so.
alleged horrific injuries to children?
I don't think you need a conspiracy.
That's all they do is peddle a conspiracy.
What has happened is that nobody has independently funded a research to uncover what has happened to our
Are you
children.
saying that the
which is
Department of
a
Health,
different thing altogether.
you saying that the Department of Health, there are doctors there who knowingly are concealing that MMR causes horrific injuries to children?
Yes! Yes, we are.
Well, then there's something.
And we've got children to
Why would
prove
they do
it.
that?
Explain what's happened to our children then.
Why would they
Do
do
you
that?
care about our children?
Why would they do
you
that?
care about the 1 in 100
let's
children?
go back a step.
Well, the answer is they might do that because they would argue that the good of the majority, the herd immunity argument, justifies.
and they would then publish
justifies
the British government published the evidence that the Urabe vaccine, the mumps component in the Urabe vaccine, was causing mumps meningitis.
Yeah.
They published it.
But they knew that
Government scientists who did the work.
they knew that
In
evidence.
Nottingham.
They knew that evidence before they introduced it.
Well, they
Problems in Canada, and they didn't investigate.
Well, let's not go into that whole thing. Okay, well, we can do Urabe if you want, but I have to go on to Urabe because it's a historical matter. But now, do we wait?
But they made a mistake. It shows they made a mistake, and they were later prepared to acknowledge it.
Well, yeah, good point. There you are.
All we're
So why would they-
all we're trying to do here is to get sufficient momentum behind us to properly investigate what happened to our children.
Well, haven't they been investigated? There were 1,600 children.
Not clinically.
Clinically investigated. What do you think they were doing? That's what they've been doing here.
No, it's
They did
epidemiological.
ileocolonoscopies, lumbar punctures, MRI scans. They did.
No, they've got that. You can go on 1,600 children.
Not all 1,600. That's right. So they don't. But enough of them. How many people read that? They were published a month ago.
That's right. So they dismissed most of them without proper explanation. When you actually read the detail of that, you would have never
Autistic
designed
children,
that.
as you must know better than almost anybody, autistic children are among the most investigated patients that ever come to